Examples of calculations of doses of vasoconstrictors. Ratio concentrations represent grams per milliliter. 1:100,000 is equivalent to 0.01 milligram per milliliter or 10 microgram per milliliter. 1:200,000 is equivalent to 0.005 milligram per milliliter or 5 microgram per milliliter. 1:50,000 is equivalent to 0.02 milligram per milliliter or 20 microgram per milliliter. 1 cartridge of epinephrine with a ratio of 1:200,000 is equivalent to 9 microgram. 1 cartridge of epinephrine with a ratio of 1:100,000, the equivalent is 18 microgram. 1 cartridge of epinephrine with a ratio of 1:50,000, the equivalent is 36 microgram. And 1 cartridge of levonorepinephrine with a ratio of 1:20,000, the equivalent is 90 microgram. The use of local anesthetics during pregnancy depends on the drug and the U.S. Food and Drug Administration category. The U.S. Food and Drug Administration category of injectable lidocaine and prilocaine is B, and for articaine, bupivacaine, and mepivacaine, the FDA category is C. Using vasoconstrictors, epinephrine with a ratio of 1:200,000 or 1:100,000, the FDA category is C. And with levonorepinephrine with a ratio of 1:20,000, it was not ranked. Topical local anesthetic like benzocaine, the FDA category is C, and lidocaine, the FDA category is B. There are 3 special patient populations to remember in using local anesthetic in dentistry, and these are pregnant and lactating women, children, and elderly patients. The local anesthetics and vasoconstrictors used in dentistry can be safely administered to the pregnant or nursing patient. However, aspiration must always be carried out to minimize the likelihood of intravascular injection. Use of these agents enables definitive treatment, which may in turn allow the avoidance of prolonged use of systemic analgesics and antibiotics. Lidocaine and prilocaine have the best Food and Drug Administration ranking. Lidocaine may be preferably because it has a low concentration formulation, which make it easier to minimize the total dose. For topical preparations, lidocaine also has the safest rating. Although high-dose vasoconstrictors used to manage significant hypotension may be a concern for pregnant patients, the doses of epinephrine used in local anesthetic formulations for dentistry are so low that they are unlikely to significantly affect uterine blood flow. The benefits of epinephrine or levonorepinephrine at the concentrations found in dental anesthetic cartridges justify their use. The main concern in pediatrics is the relative ease of inducing an overdose. Before administering local anesthetic to a child, the dentist should determine the child's weight and calculate the maximum dose to help prevent inadvertent overdose. Given the concerns regarding toxicity, selections of a low concentration solution appears prudent. Thus, 2% lidocaine with epinephrine with a ratio of 1:100,000 may be the ideal local anesthetic for a child. Bupivacaine is best avoided in children because of its long durations of soft tissue anesthesia. There should be no concerns regarding prolonged duration of action due to vasoconstrictor, as it has been shown that soft tissue anesthesia does not differ significantly between 2% lidocaine with epinephrine with a ratio of 1:100,000 and 3% mepivacaine plain or 4% prilocaine plain. There are no significant differences in the response to local anesthetics between younger and older adults. Therefore, the doses required for each block are the same regardless of patient age. Nonetheless, it is prudent to stay well below the maximum recommended doses, as elderly patients often have some compromise in liver function. Responses to vasoconstrictor should not be considered significantly different in elderly patients, but some degree of cardiovascular compromise can be expected, even without an overt history of heart disease. Therefore, reducing the dose of epinephrine may be prudent. All local anesthetics used in dentistry are efficacious. The decision regarding which drug to select should be based on the estimated duration of action required, the patient's medical history, and potential drug interactions. Solutions without vasoconstrictor, namely mepivacaine and prilocaine plain, may be selected for short procedures, particularly those involving mandibular plaque, where vasoconstriction is less important. These drugs may also be used when epinephrine must be avoided, as in patients with severe ischemic heart disease or recent myocardial infarction. Bupivacaine can be selected with long duration of action as desired, particularly in the mandible. Lidocaine with epinephrine may be preferred for treatment of children and pregnant patients. Any one of articaine, lidocaine, mepivacaine, or prilocaine may be considered for routine dental procedures. Use of epinephrine can be justified for most dental procedures, but it may be necessary to minimize the dose for patients receiving specific medications and those with cardiovascular disease. Thank you so much, Dr. Danielle. More power and God bless you.